As pediatricians, it is our responsibility to ensure that we're able to provide the best possible care to our young patients, regardless of the circumstances. One way to do this is by being personally prepared for any situation that may arise. This includes both natural disasters and man-made emergencies. Personal preparedness is the process of being ready for emergencies or disasters. This involves taking steps to protect ourselves, our families, and our communities from potential hazards. Some ways to be personally prepared include creating an emergency preparedness plan, having a disaster supply kit on hand, staying informed about emergency alerts and warnings, and knowing how to evacuate or shelter in place. It's also important to have a plan for how to communicate with loved ones in the event of an emergency. Personal preparedness is crucial in helping us to be ready for any emergency situation and to protect ourselves and those around us. Without being personally prepared as individuals and families, we'll not have the ability to respond should our hospital or patient population need us to provide medical support. A hazard vulnerability analysis, or HVA, is a crucial tool in preparedness. This process involves identifying potential hazards that we may face in our work, whether they're natural disasters such as tornadoes or hurricanes, or man-made emergencies such as power outages or chemical spills. We can then evaluate the likelihood and potential impact of each hazard. For example, if we work in an area that's prone to earthquakes, we'll want to be prepared for the possibility of an earthquake occurring and the potential impact it could have on our patients and our ability to provide care. By working through the HVA tool, we can risk stratify our potential hazards and see which among them needs to be focused on. Conducting an HVA is a joint commission requirement for hospitals to aid in their ability to focus their emergency management activities on the most likely threats. Once we have identified our hazards, we can take steps to prepare for them. This may involve creating an emergency preparedness plan and ensuring that we have the necessary supplies and equipment on hand to provide care in an emergency situation. These supplies should include items such as non-perishable food, water, flashlights, and first aid supplies. We should also have a plan in place for how we will communicate with our patients and our staff in the event of an emergency, whether it's through a phone tree or through social media. It is also important to stay informed about weather-related events and to have a plan in place for how we will respond if a weather-related event occurs. This may involve having a plan for how to evacuate our patients and our staff, as well as having a plan for how to provide care to our patients if we're unable to leave the hospital or clinic. Hospital-based providers should be aware of the emergency response plans in effect at their institution and what they might be called upon to do. As an example, here at Texas Children's Hospital, we're closely watching the Gulf during hurricane season. When storms form, we have meetings early and implement our incident command. If we feel there's a strong likelihood that our region will be impacted, we activate Ride Out, which is where we bring all essential staff into the facility and have them shelter in place throughout the duration of the event to ensure that we have all the necessary staff to continue to provide patient care. Most weather-related events come with some advance warning. Whether it's an impending blizzard or a hard freeze, a hurricane or a nearby wildfire, there's usually adequate time to enact appropriate plans for responding, such as closing clinics and rescheduling appointments or canceling elective procedures until after the event has passed. The disaster cycle consists of 4 stages: preparedness, response, recovery, and mitigation. As pediatricians, it's important that we are prepared for each stage of the disaster cycle. During the preparedness stage, we can take steps to prepare for potential emergencies by conducting a hazard vulnerability analysis and creating an emergency preparedness plan. During the response stage, we'll need to act quickly to provide care to our patients and to protect our staff. During the recovery stage, we'll need to help our patients and our staff recover from the effects of the disaster. And finally, during the mitigation stage, we can work to prevent future disasters from occurring. Overall, personal preparedness is crucial for pediatricians who work in hospitals and clinics. By conducting a hazard vulnerability analysis and being prepared for potential disasters, we can ensure that we are able to provide the best possible care for our patients in any situation. By being prepared for each stage of the disaster cycle, we can be confident that we are ready to handle any emergency that may arise.